Megacast 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. Today's edition of the Megacast begins now. Welcome to the Megacast, our live daily TV, radio, and streaming show talking about all things Michigan. I'm Tyler Kieft. Today we'll be talking to a number of people about topics of interest and importance to Michiganders just like you. Let's begin with what's making headlines across our local area and around the state of Michigan at civiccentertv.com. On our local news page, our top story comes from Frank Witzel at the Detroit Free Press. Your weekly, maybe bi-weekly fill-up at the gas station is about to get pricier once again as the average price of gas in Michigan rose 13 cents per gallon from last week, currently sitting at $3.32 per gallon on average. AAA spokesperson Adrian Woodland said this can be accredited to a rise in demand and stock prices remaining tight, meaning prices may continue to rise in the future as well. To put that into numbers, gas demand rose recently from being about 8.71 million barrels per day to 9.33 million barrels per day, that according to the Energy Information Administration. Here in Michigan, the most expensive average gas prices are in Lansing at $3.34 per gallon, same thing in Grand Rapids, and then Ann Arbor at a slightly less expensive $3.33 a gallon at this time. The least expensive average gas prices in Michigan are way up in Marquette at $3.28 per gallon, Traverse City at $3.30 a gallon, and Benton Harbor at $3.31 per gallon, just 1 penny below the current average across the state. You're going to need to revise that 2023 budget just a bit to make sure you have room for gas money after those prices came in over the first week and saw another rise of over 10 cents per gallon after a few weeks near the end of the year before the last week and into the first week of the new year, where we saw some dropping in the prices of gas to right around $3 per gallon. Also making headlines today on civiccentertv.com's local news page from our friends at the Detroit News and author Melissa Nahn-Burke. The Vice President, Kamala Harris, will be making her way to the Great Lakes State later on this week to attend an event on climate change in Ann Arbor. Harris will attend the event on Thursday to, quote, highlight the Biden-Harris administration's historic and ongoing work to combat the climate crisis, end closed quote. This will be Vice President Harris's third visit to Michigan since she was inaugurated in late January of 2021, with her most recent visit before this being to attend a fundraiser ahead of the midterms with Governor Whitmer, as well as a job training site for the nonprofit Focus Hope and a voter education event for students. Harris's third visit brings the Biden administration's highest executives, the vice president and the president, to 10 total visits during their tenure, with the president having visited Michigan 7 times to Harris's soon-to-be 3. Finally, making headlines today on civiccentertv.com's local news page from Emily Bingham at MLive. You will soon have a chance to witness something that hasn't been seen since the days of the Neanderthals. Comet C/2022 E3 ZTF will be on close approach to Earth late this month and into early February, getting as close as just 28 miles from the planet, that according to space.com. From calculations of the comet's orbit, it's estimated that this is the first time that the comet has traversed our solar system in 50,000 years. Expect the closest approach to the sun to be on January 12th, making its closest approach to Earth marked on or about February 2nd of this year. Experts say it should be visible with telescopes, binoculars, and in some areas, even potentially be visible with no equipment but the naked eye. Direct from this article, quote, for observers whose view of the comet may be impeded by weather, moonlight, or light pollution, the Virtual Telescope Project is hosting a free live stream of the comet beginning at 11 p.m. Eastern on January 12th. The live stream will be shared on the project's website as well as its YouTube channel, both of which Emily Bingham has so kindly linked in this article. You'll want to check it out, click through, learn more about this comment. And even if you go to our website at civiccentertv.com on our local news page, we do have an image courtesy of AccuWeather That is the thumbnail picture for that article. So you get a little bit of a preview of what you may be seeing through your telescope, through your binoculars, or if you're in an area that maybe has a little bit less light pollution, a little bit less densely populated, maybe away from the cities a little bit. Northern Oakland County into other areas of mid-Michigan, certainly up in the northern part of the lower peninsula and into the upper peninsula, where there tends to be less light pollution, and even in more populated areas of those regions of the state. You may only have to just simply look up at the sky and see this once in a lifetime visual from outer space. All those headlines are on our website, civiccentertv.com, on our local news page, along with links to COVID-19 updates and information from the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, and as well as the Oakland County Health Division. That's all of our headlines from this week as well, not just today's, but all of them that come around this week. So whether you're tuning in to this program on the day of its recording and its live show, or you're tuning in at a later time when it's a little bit more convenient for you, catching up on all your local news when you can catch up on all your local news and information, this is a great way to take a look back at what's been the top stories in our local area and across the state each and every day this week. civiccentertv.com on our local news page. We have a great show ahead on this Tuesday edition of the Megacast. Coming up next, we'll talk about keeping these pearly white chiclets healthy this year, as well as other oral health issues and the dental health effects on your overall health. That's coming up next. Stay tuned. You're going to want to learn more about that from experts in your local area. You're watching and listening to the Megacast.
In the face of COVID-19, staying healthy is important.
And now the same is true in the face of flu.
Influenza has the power to infect millions.
But it's easy to protect yourself, your family, and your community.
The flu vaccine is safe and effective. And with COVID-19 still around,
it's essential. Together we can face flu season head on.
Visit michigan.gov/flu.
Hey Laker fans, do you know a friend or neighbor that volunteers in Greater West Bloomfield? We would love to help you recognize them at the 51st Annual Michigan Week Awards. Countless members of the communities of Orchard Lake, Keego Harbor, Sylvan Lake, and West Bloomfield give their time and talent daily without regard for recognition. You can help recognize these individuals and organizations at our awards breakfast next year on May 12, 2023. Nominate your neighbor or organization starting January 28, 2023. Go to michiganweek.org for details.
1 in 4 Michigan homes has high levels of radon, a naturally occurring radioactive gas known to cause lung cancer. It doesn't matter where you live or what type of home you have. You won't even know it's there unless you test. So don't wait. Testing is cheap and easy, and if there's a problem, it's simple to fix. Visit michigan.gov/radon to learn more.
We took action. Will you?
Many people are feeling overwhelmed and struggling with mental wellness these days. So be kind to your mind. Give yourself permission to breathe. Share your feelings. You are not alone. Have hope. Talk to a Stay Well counselor for free confidential help 24/7 through the COVID-19 hotline.
Watch Civic Center TV with our brand new live captions. To turn on live captions, go to civiccentertv.com and click Watch Live. In your web browser, click on the Options tab in the top right and find the Accessibilities tab. Then just switch on live captions to heighten your enjoyment of our local programming. Thank you so much for watching Civic Center TV.
Welcome back to the Megacast, our live daily TV, radio, and streaming show talking about all things Michigan. I'm Tyler Kieft. Learn more on our website, civiccentertv.com/megacast, where you'll find more information on all of our partnering stations across the Great Lakes state, including our co-flagship, My Michigan TV, and find all of our full shows and each individual interview on demand. Again, the website, civiccentertv.com/megacast. Well, it's the beginning of a new year, and at the beginning of a new year, the early portions of the year, a lot of people make goals to check in on their health or reclaim their health in the new year. And a great way to do that is to check in with all of your with all of your usual physicians and other medical professionals, including your local dental and oral health professionals as well. Joining us now is Dr. David Benuni from Lifetime Dental on today's edition of the Megacast. Dr. Benuni, thanks for being with us.
Hey, Tyler, thanks for having me so much. I appreciate it.
Yeah, glad to have you on. First off, as we're talking about reclaiming our health in 2023 and focusing on how we can both check in on where our health is at and what steps we may need to take to improve certain areas of our health. How does our dental health, our oral health play into that sense of our overall health and well-being?
Yeah, absolutely. I mean, I think a lot of people are starting to hear more recently as we make a push towards understanding how our mouth and our teeth kind of integrate with our whole body. There's a lot of studies that are coming out, educating us that taking care of your teeth and your gums is an important way to control your cardiovascular health and reduce your risk for heart disease. We're finding that there's strong links between gum disease and diabetes. And so making sure that you're taking care of your teeth and your gums can help in reducing your risk of these and many other systemic diseases that maybe before we didn't quite realize how closely related they were.
And just when our oral health maybe isn't in check, when we have some maybe gum damage or our teeth have undertaken a lot of wear and tear over the years and maybe haven't been checked in on in a while, what kind of negative or adverse health effects can that have in other areas of our health, not just in our mouth?
Sure. Like I had previously mentioned, you can increase your risk of diabetes. If you have diabetes already, you can further complicate other symptoms, including, glaucoma and neuropathies and all these different things. If you have a higher risk for heart disease or cardiovascular disease, then the inflammation from your gum tissue can increase those risks in other areas, including, your heart, or increased risk of heart attack and all these different kinds of things. But I think the point that I'd like to make most is not that we should be afraid of these possible consequences, but rather, especially in the new year, like you're talking about resolutions, we can use this as an opportunity to get into our health professionals, talk to our cardiologist, talk to our primary care, talk to our dentist, and start to create goals and paths so that we can eliminate any of these risks if we already have them. It's never too late to get started, and I think that's the message that the dental community wants to get out there is we're here to help you.
You can get in contact with Dr. Benuni and other professionals across Lifetime Dental Group in the local area here in Oakland County by visiting their website, lifetimedentalgroup.com, lifetimedentalgroup.com, which also includes phone numbers to get in contact with their local offices in Canton, South Lyon, and West Bloomfield, all across the Oakland County area. Again, lifetimedentalgroup.com is the website. And Dr. Benuni, no one really seems to enjoy going in for a doctor's visit, let alone going in to the dentist office, but it's a necessary part of our lives and checking in on our health. So, one of the complaints that maybe is there when people are going to the dentist is, all they do is they poke and prod in my mouth. It's painful. It's uncomfortable. So from your perspective, what are things that you and that dental hygienists are looking for when a patient comes in for that annual or maybe twice or three times annual check-in at the dentist office?
For sure. So I know in my practice, like at Lifetime Dental, my objective is to, first of all, we're patients sometimes too, right? We know what it feels like to be on the other side of the chair, because as much as we probably don't like going to the dentist that much either, to be honest. So it's about creating that relationship and finding that rapport. You may, when you find a dentist that you enjoy and you feel comfortable with, it's going to improve that relationship and make you feel as the patient that you're going to have more success. I think part of that is finding the right doctor. And I think part of that from the hygienist and the dentist perspective, and what we strive for at our practice is to make sure that we're trying to provide that environment for you. We know nobody wants to be at the dentist. That's not something that we're like, oh, you should enjoy being here. No, we just want to make it the best possible scenario for you. That's what we're striving for at our practice.
We're joined by Dr. David Benuni on today's edition of the Megacast from Lifetime Dental Group. Again, more information can be found on their website, lifetimedentalgroup.com. lifetimedentalgroup.com, including a list of services, special services, and their locations across Oakland County. That is lifetimedentalgroup.com. And as we talk about your locations here in Oakland County, you do have a new location that has opened up recently. Tell us about that and some of the improvements that have been made in your practice by having this new location.
Yeah, we're really excited about this new office that we just opened in West Bloomfield. It's on the corner of Orchard Lake Road and Lone Pine, right across from the Kroger. We've brought in some new technologies with us that we're really excited to share with our patients, including heated and massaging chairs, so that you don't have to focus on what is happening in your mouth. We've got really incredible ability to treat folks using these chairs. And we have new technology that improves our ability to treat you by reducing the sound that the handpiece makes. Nobody likes the noise of going to the dentist. So some of these modern technologies, modern equipment can help to reduce those sounds and try to make a more pleasant environment. And we're really excited to be able to share that with the West Bloomfield community. And we're working on bringing it into our other offices also in Canton and South Lyon.
More information can be found on the website, lifetimedentalgroup.com, or if you'd like to get in contact with their new West Bloomfield practice, you can call them 248-855-8000, 248-855-8000 to get in contact with Dr. Benuni and the professionals at Lifetime Dental Group at their new location in West Bloomfield or at the other locations in Canton and South Lyon here in Oakland County. And so Dr. Benuni, over the last few years, we know that people have maybe taken a break from going into their doctor, getting their regular checkups because of the COVID-19 pandemic. So as people have come back over the last year or so and continue to come back in 2023 and maybe finally get those check-ins or come back in for follow-ups from the past year or so, what are some of those common ailments that we are seeing, the common issues that we're seeing in our dental offices, either at your practice or from other colleagues in the industry that you've spoken with?
Yeah, everybody's doing a little bit of catch up, I think, when it comes to taking care of their health, like you mentioned. And so how that impacts us in the dental community is we find that some folks are now suffering from, a little more cavities than they may have had in past years when they were more regular with their checkups. And we're seeing some folks, with a little bit more inflammation, more plaque and tartar on their gums and on their teeth. Most of the time, these are conditions and symptoms that are reversible or can be easily treated, but the more time that goes by without having these conditions addressed, the higher risk you can leave yourself at for more complicated or more serious disease. So I think folks are a little hesitant sometimes when they've missed a few appointments to get back in, or they're embarrassed that they may have missed some time. But I promise you, whichever healthcare professional you see, there's no judgment being passed. We're just glad to be able to help you and welcome you back into the office, whether it's been 6 months or 6 years. We're here to help.
LifetimeDentalGroup.com is their website to learn more information. You can get in contact with them there as well for services in Canton, in South Lyon, and now in West Bloomfield Township, just off of Orchard Lake and Lone Pine, down by the Kroger location at Crosswinds Shopping Mall in West Bloomfield. Again, more information, LifetimeDentalGroup.com to get in contact with Dr. Benuni and the team at Lifetime Dental. Anything else, Dr. Benuni, that we should be focusing on at this time for either our patients or that you're really looking out for in your practice or changing up in recent times to provide greater care for people's oral health?
Yeah, for me, it's about overcoming barriers. And when I think of the number one barrier to oral health, at least in our community here, it's anxiety and fear. And so I'm always striving to try and make people feel more comfortable in our space and in the dental space so that they can have more successful outcomes. Unfortunately, the only way to be successful with your dental care is to visit the dentist, and that's not so easy for everybody. But if we can work as a community and as a dental, community to improve these symptoms and try to ease everybody's anxiety, then we can have more success as a community in whole. And I'm excited to play a role in that.
And so elaborate on that a little bit, if you would, what steps you then take as a professional and those that you work with at Lifetime Dental Group to make that experience a little bit more comfortable, or to ease some of those worries that people may have that are, as you said, pretty common, especially over the last few years, as people have maybe missed appointments or missed several appointments and are just now getting back in to these regular checkups?
It's about communication, and it's about, sitting down and spending a few minutes getting to know somebody. Having someone put their hands in your mouth is an intimate thing. And so you don't want to have a stranger, placing their hands in your mouth. So it's about creating a relationship and about creating a friendship and a working professional relationship where we can trust each other. So I strive, and me and my partners at Lifetime Dental, we strive to get to understand each individual, learn where those anxiety or fears might come from, and then we can change how we approach your care in order to avoid things that might trigger your fears. And it works.
You can find more information and get in contact with the professionals at Lifetime Dental Group by visiting their website, lifetimedentalgroup.com, or calling either of their 3 locations in Canton, South Lyon, and West Bloomfield, all of which can be found on their website. Dr. Benuni, anything else for us before we say goodbye today?
I appreciate the opportunity to speak with you, Tyler. Thanks for having me on, and I look forward to meeting as many members of the West Bloomfield community that will entrust us with their care. Thank you so much.
Again, appreciate having you on as well. Once again, their new location in West Bloomfield, just across from the Crosswinds Shopping Mall, the Kroger location at Lone Pine and Orchard Lake. We'll take a break on the Megacast. On the other side, we'll continue to focus on public health and your own personal health. We'll talk to some individuals from the American Red Cross about one way that you can protect your own health and your family's health without ever seeing a medical professional, and a way that you can donate something that you produce each and every day to save a life in your community and communities far, far away from where you're located. That's coming up next. You're watching and listening to the Megacast.
When you have a gambling problem, you have a money problem. Don't let your gambling cause you financial hardship. If you or someone you love is struggling with gambling, we can help. Get free confidential counseling and win your life back. Learn more at michigan.gov/problemgambling.
The heart of winter. It beats inside you. It's that thing urging you outside when the forecast calls for snow. Some were born with it. For others, it was carved with care. But for all who take winter to heart, it's time. Feel the rhythm of the season and pursue your Pure in Pure, Michigan.
Wake up, Greater West Bloomfield. Start your mornings with The Splash and tune in for The Splash Live. Get acquainted with people, places, and activities that are live, local, and for you. First thing in the morning, weekdays at 9:30 a.m. on our Civic Center TV YouTube page, or watch us live at Civic Center TV or on Facebook. The Splash Live, Greater West Bloomfield's live update show.
Wondering what to say to someone who's been sexually assaulted or abused?
I believe you. I'm so sorry this happened.
It's not your fault.
Confidential and anonymous help is available at the Michigan Sexual Assault Hotline. Connect with us 24/7. Call 855-VOICES-4 or text 1-866-238-1454 for help. Learn more at michigan.gov/voices4.
Ronnie started doing prescription pills at the age of 15, and by 19, he died. If your child is struggling with drug use, try not to be too proud to reach out for help. Don't be worried about what the neighbor will think or your family. Just get your child the help they need. Sometimes it's the hard road to take, but the hard road is nothing compared to living with the fact that your child is no longer with you.
There's hope and help at drugfree.org.
Martin Luther King Jr.'s dream lives on with United We Walk, an event that celebrates Dr. King Jr.'s birthday by embracing unity, diversity, and acceptance. Volunteer, participate, or donate to bolster your community and engage with your fellow citizens. For more information, scan the QR code on screen or go to unitedwewalk.org. Show your support Sunday, January 15th, 2023 from 1 to 3 p.m. at the new West Bloomfield Middle School.
I'm feeling good.
Let's savor these moments. Made possible by the COVID-19 vaccine. Keep the dining out going by keeping yourself protected and your COVID-19 vaccines up to date.
I'm Steve Eiserman of the Detroit Red Wings, and I think every child in Michigan deserves a safe, healthy, and happy childhood. Can we build a state where Children Trust Michigan isn't just a name, but something our kids believe? Please support Children Trust Michigan as the voice for children and families by visiting the website to learn more.
To ring in the new year, the West Bloomfield Chamber of Commerce welcomes the 2023 Board of Directors. Don't miss this opportunity to network with and congratulate the movers and shakers of our community, show your appreciation, and more. With the whole event officiated by Judge Diane DeAugustini. Register at westbloomfieldchamber.com. Entry is $20 for non-members and $10 for members. We'll see you January 13th.
When the temperatures are chilly, being together warms the soul. Keep the winter fun going. Help protect yourself and those around you by keeping your COVID-19 vaccines up to date.
What's happening around you? Hear about state events, businesses, and from the people behind them on the Megacast, an hour-long TV, radio, and streaming show keeping you informed on the day-to-day news. Listen in on talks with volunteer groups, documentarians, and financial advisors, Monday to Friday with your host, Tyler Kieft. Catch the Megacast weekdays from 10 a.m. to 11 on Civic Center TV, 89.3 Lakes FM, and streaming on mymytv.com. Catch some exciting games of basketball from high schools all over at the Laker MLK Classic. Cheer on your students and their competitors as they honor the freedoms and rights Dr. King fought to protect. Bring a friend, your family, or an acquaintance and get a good seat before 11 a.m. Monday, January 16th at West Bloomfield High School. The Lakers MLK Classic.
There are many different kinds of noses. Our noses can sniff out all kinds of things. Good things and bad things. Your nose knows if those sniffles are just a cold, allergies, or COVID-19. So swab it. Test it. It's good to know.
Welcome back to the Megacast, our live daily TV, radio, and streaming show talking about all things Michigan. I'm Tyler Keefe. You can learn more about our program by visiting our website, civiccentertv.com/megacast, where you'll find more information on all of our partnering stations across Michigan, including My Michigan TV, and find all of our full shows and each interview segment on demand. Again, civiccentertv.com/megacast for all of that. Joining us now on the program are two individuals from the American Red Cross of Southeastern Michigan, both their interim disaster program manager, Carnell Richardson, as well as David Olahars, the regional communications director for the Southeast Michigan chapter of the American Red Cross. Thank you both for being with us today.
Sure. Thanks for having us.
Appreciate having you both on. Carnell, we'll start with you, as this is the time of the year where we really are starting to think once again about being prepared for emergency situations as we're in the middle of the winter season now. Maybe it hasn't been as severe, as snowy as it's been in the past, but despite all of that, there's still plenty of hazards that are out there or will be coming throughout the winter that we should be prepared for, and even as we get down into later on in the year. So let's begin with what what is emergency preparedness or disaster preparedness? Because that's such a broad scope.
Emergency preparedness means having all of the tools and supplies and skills that you need in order to be prepared for a situation that may arise that's unexpected or unwarranted. Home fires are the disaster that we tend to respond to the most, not only this time of year, but all year. And we also see a lot of the fallout and effects from winter storms that impact our region greatly, but for obvious reasons. And so we want to make sure that we have supplies in case we have to evacuate certain situations. We want to make sure that we have contingency plans and somewhere to go for safety.
And so as people are putting together a plan, what elements do kind of come together to make a quality plan for an emergency escape from your home, or to prepare yourself if there is a storm coming in or some other emergency that may be oncoming in your community that you and your family should be prepared for?
We always recommend having extra food in a bag, food that won't spoil, batteries, flashlights. We always recommend having extra blankets and extra life essential items in a kit in case you have to evacuate for any reason. And then also making sure that you and your kids have emergency contacts so that if you need to leave for any reason, that you are prepared to do that.
We're joined by Cornell Richardson from the American Red Cross Southeast Michigan chapter on today's edition of the Megacast. You can find more information on their website, redcross.org/local/Michigan, or just search for Michigan Red Cross on your search engine of choice for more information. And just how much of a difference does it make, Cornell, from the Red Cross's perspective and the knowledge that the organization and you personally have on just how much of a difference it makes to have these plans in place, be prepared in this sort of way to then have better outcomes in the event of an emergency in your home or a disaster in your community?
One of the things that we want to alleviate is the stress that comes along with disaster. Oftentimes, we look at the technical aspect of having supplies on hand. However, we fail to really delve deep into the psychological aspect of it. We teach psychological first aid in the American Red Cross and making sure that we're mentally prepared, because being mentally prepared is just as important as being physically prepared. And what we want to do is reduce the stress so that in the event and in the face of emergency, people are able to manage themselves. And if they can manage themselves, they'll be able to help manage the situation.
So this is all happening before an emergency occurs. When there is an emergency and you're kind of in that process, certainly not if it's necessarily an emergency directly in your home, but more so for those outside uncontrollable disasters that may come through, like a large storm or a flood or another scenario. What steps should people be taking and families be taking during these emergencies to further protect themselves and continue to modify their plans as is needed, given the variables that they're dealing with?
We want to encourage people to stay calm and to reach out to those emergency vehicles and channels that they are able to secure in that moment. Obviously, people will want to call 911 if it's that kind of an emergency, and also they would ahead of time want to have a list of emergency contacts that they can call on in the face of emergency. But we also want them to know that you can call the American Red Cross for disaster-related emergencies, and we are available 24/7. And we want to be the best part of someone's worst day ever.
You can find more information on redcross.org about different programs, different resources and information about disaster preparedness and more. redcross.org, and you can search Michigan region of the American Red Cross to find more information on the Red Cross's work directly here in our communities here in southeastern Michigan and across the Great Lakes state. And then, as you mentioned, after an emergency, some of the steps that you can take would be to contact the American Red Cross or other organizations that may be able to help in the wake of these emergencies. What steps should people be taking after the fact once they have gotten that all clear? They're on the other side of an emergency or a disaster in their community, to then begin the recovery process, which can often be just as treacherous and difficult as the preparedness and dealing with a disaster as it happens.
Sure. If those individuals have insurance, and it's an insurance related emergency where insurance would cover it, I would recommend calling your insurance company. If they need recovery kinds of resources that the American Red Cross can offer. For example, we respond to house fires the most. Call 1-800-RED-CROSS. There are other services that other social service agencies offer. And I would also recommend reaching out to United Way 211. We have many partners that we reach out to that step in when there's things that the scope of our work does not cover.
So
Making
what sort
sure
of
that they reach out.
So what sort of resources then, Cornell, are available to people in Michigan and others that may be looking for some help in making these plans and executing these plans and what to do after an emergency from the American Red Cross?
We do offer emergency financial assistance to those who qualify following an emergency. And so they would dial 1-800-RED-CROSS and they would reach someone in our national headquarters who would then route the call to our local responders who would reach out to those persons who've been in those emergencies. And then we will begin the process of assessment from there to see what we could do to help them. And if we can't help them, we will make sure that we refer them to someone who can.
We're joined by Cornell Richardson, the interim disaster program manager in the Southeast Michigan chapter of the American Red Cross, on today's edition of the Megacast. We're also joined today as we'll transition now to another topic of interest for the American Red Cross with David Olahars, the regional communications director for the Southeast Michigan chapter. It's also, as we think about disaster preparedness and we think about storm season, we also think about other things that have happened across our nation and other areas that are supported through programs such as the American Red Cross and organizations like the American Red Cross. And something that this always comes back to is the ability for people to directly help in their communities and others through blood donation. So David, we always hear that the need for blood is always there and it's always quite significant. What is the status right now from the American Red Cross in terms of just how much blood is needed through blood donations to continue its services at the rate that it goes at?
So every 2 seconds in this country, somebody needs blood, right? So think about that, right? Every 2 seconds, somebody needs blood. So that could be a loved one, right? It could be a neighbor, it could be a coworker, it could be premature babies, new moms, cancer patients, accident victims. So when people can donate blood, it can make blood available to these folks who are in need of it. It also helps hospitals to be at the ready to meet these hospital needs for these patients. You know, last month, you know, we had that significant winter storm, and there were about 300 blood drives canceled across the country. So we need to go back and you know, reset and collect blood now to meet the demand that's coming up here at the first of the year. January is National Blood Month. So what better way for people to get out and give blood? If you're thinking about a New Year's resolution, why not make giving blood that New Year's resolution?
You can donate blood quite often. There is a short period in between the sessions that you can have to donate blood, but each time you do, it's making quite a significant contribution in this effort. David, elaborate on that and just how much of an impact one person donating blood, even one time, can have in this effort from the American Red Cross and with its partners who are providing this blood to patients in need.
We know blood donations save lives. So each person who donates blood, they can be assured that that blood is going to help a cancer patient. It's going to help, a new mom, premature babies, accident victims.
And these people across all blood types too. And so regardless of what your blood type is, it's very much encouraged that you do if you have the ability to do so, or at least to get tested to see if you are eligible to donate blood to do so. David, across our local area, if people want to get involved, not just by donating blood, but also by organizing blood drives through the American Red Cross, what steps should they be taking, or do they need to take in order to get in contact with you and your organization and make that happen in their local community?
We have a wealth of information on our website, Tyler, and folks can go to redcrossblood.org, and there's tons of information that will guide people on how to set up a blood drive in partnership with the Red Cross. Matter of fact, we have blood drives going this week in partnership with the Garden and White Furniture Store. Today, Tuesday, January 10th, and then Thursday, January 12th, we have blood drives going at their 11 stores across Southeast Michigan, as well as in Saginaw. And then this weekend, we're kicking off what we call the Big Ten Blood Battle. That's going to challenge the University of Michigan, Michigan State, Penn State, and the University of Wisconsin in collecting blood donations from their respective universities.
Again, more information can be found on blood drives in your local area, as well as hosting a blood drive at redcrossblood.org. It's as easy as going to that website. Right at the top right of their page in your computer web browser is a find a blood drive link that you can put in your zip code, and you'll be able to find a blood drive near you that you can help provide this blood to. As David said, every 2 minutes, somebody is in need for blood. That's 120 people per minute, and through typically 15 to 20 minute interview segment of this show. That means during the time we've been speaking with Carnell and David, as many as 1,800 people are in need of blood, and you can help to contribute to that. David, anything else we should know about the Red Cross's blood donation program before we let you go today?
Just a clarification, Tyler, every 2 seconds, somebody needs
2 seconds.
blood.
Okay, never mind. Yeah,
Yes.
I apologize. I said 2 seconds.
No,
David,
folks, the blood donation process is very simple. There's 3 ways for you to make an appointment. You can go to redcrossblood.org. You can call 1-800-RED-CROSS, or you can download the Red Cross donor app and make your appointment that way. It takes about an hour of your time to donate, although the formal donation process takes about 8 or 10 minutes.
More information can be found at redcrossblood.org, as well as other information on services and programs through the American Red Cross at redcross.org. Carnell, David, thank you both so much for joining us.
Thank you for having us.
Appreciate it. Redcross.org for more information on the American Red Cross, including their Southeast Michigan chapter, and how you can get involved. We'll take a break here on the Megacast. After this very short break, we'll come back and talk to one of over 300 charities and nonprofits supported on the Share Detroit platform. This is the Megacast.
In the face of COVID-19, staying healthy is important.
And now the same is true in the face of flu.
Influenza has the power to infect millions.
But it's easy to protect yourself, your family, and your community.
The flu vaccine is safe and effective. And with COVID-19 still around,
it's essential. Together we can face flu season head on.
Visit michigan.gov/flu.
Hey Laker fans, do you know a friend or neighbor that volunteers in Greater West Bloomfield? We would love to help you recognize them at the 51st Annual Michigan Week Awards. Countless members of the communities of Orchard Lake, Keego Harbor, Sylvan Lake, and West Bloomfield give their time and talent daily without regard for recognition. You can help recognize these individuals and organizations at our awards breakfast next year on May 12, 2023. Nominate your neighbor or organization starting January 28, 2023. Go to MichiganWeek.org for details.
1 in 4 Michigan homes has high levels of radon, a naturally occurring radioactive gas known to cause lung cancer. It doesn't matter where you live or what type of home you have. You won't even know it's there unless you test. So don't wait. Testing is cheap and easy, and if there's a problem, it's simple to fix. Visit michigan.gov/radon to learn more.
We took action. Will you?
Welcome back to the Megacast, our live daily TV, radio, and streaming show talking about all things Michigan. I'm Tyler Keefe. Learn more on our website, civiccentertv.com/megacast, where you'll find more information on all of our partnering stations and find all of our full shows and each individual interview on demand as well. civiccentertv.com/megacast. Joining us now on the program is one of over 300 charities and nonprofits supported on the Share Detroit platform, the Detroit Institute for Children's Chief Program Administration Officer, Ara Hachigian, joins us now on the Megacast. Ara, thanks for being with us.
Thank you so much for having me. Good morning.
Appreciate having you on. So first off, give us a little bit of information and background on what the Detroit Institute for Children is and some of the programs and services that are provided by you.
Certainly. So Detroit Institute for Children is a 102-year-old nonprofit that was founded in the city of Detroit to treat originally children that had TB and polio. But we've come a really long way since then. And as needs have evolved, the agency has always evolved to serve whatever the greatest need is. So currently we provide special education services, we provide early childhood intervention services, everything from speech, occupational physical therapy, social work, psychology. We have a team of special education teachers and special education consultants and paraeducators, as well as a team of academic and literacy tutors that work in our after-school program.
So how do people get involved with the LEAP program? What sort of students or children are getting into these sorts of programs, or are these programs then designed for?
So great question. So the LEAP program is a newer initiative for us. It's our community-based initiative. It stands for Learning Enrichment Achievement Programs. And it encompasses 3 different kind of areas in which we offer some services. So the first is our after-school program, which focuses in K through 12 academic and literacy tutoring after school. The second part of LEAP is early childhood, which includes our Parents as Teachers program, which is a home visit program where our parent as teacher educator will visit homes and provide parents with resources and training materials and books and supplies, anything that might be needed for prenatal all the way through 3 and 5-year-olds. So that's a second part of LEAP. And the third part is our summer learning program, which is probably one of the biggest and most exciting parts of LEAP. Where children that receive special education services during the school year come to us for sometimes 5 weeks out of the summer, and they work on their goals that they would normally be working on during the school year with our staff of therapists and educators during the summer. These are all community-based free activities and free services that we offer. And so people can, enroll their children. They don't have to be seen by a Detroit Institute for Children program or staff member during the school year in order to qualify. It's open to children all over. There's a virtual component to it in the summer, which also makes it really accessible for children in Michigan that might not be in the Detroit area. So these programs run all over Southeast Michigan, West Michigan, and we're moving more toward the center of the state now too, which is really exciting.
More information can be found in a couple of places. ShareDetroit.org, where they're one of over 320 charities and nonprofits supported on the platform, as well as at their direct website, DetroitChildren.org, DetroitChildren.org. And already mentioned that parents can get their children right into these programs, even if they're not necessarily being attended to directly from Detroit Institute for Children individuals during the school year. But typically, how are kids coming into your programs and getting associated with your organization? Is it usually referral, or is it mostly word of mouth and parents coming in and enrolling their children?
That's a great question. So we actually work with a lot of children in schools. We're in nearly 200 schools, Head Start, and early intervention programs all over Michigan. And so that's how we get a lot of our children, particularly they carry over into the summer and into our after school program. But children all over can enroll. We hear from parents all the time through schools, directly to us. We've been around a really long time, so people know our name and people hear who we are. They get in touch with us, and our services have changed over the years, but it's still very child focused, and we specialize in children with special needs, but all children have some needs, right? And so they're children first. And so most of our programs don't require a diagnosis or a special education program or an IEP, though during the school year, IEP-based services are provided pretty significantly, but parents can reach out to us directly, and we can figure out the best way that we might be able to, help their child or work with their child, or what program might work best for them. And if it's not something that we can do, we have a lot of just wonderful community partners that we refer people to all the time.
And as you mentioned, are the community partners that you're referring kids to, that you're working with at the Detroit Institute for Children. You recently partnered with the Trees Giving Foundation. Tell us about that partnership and how your organization and this organization got involved together.
I love this part of my job. The Trees Giving Foundation is a really fabulous little nonprofit that was started here in Waterford, Michigan, with a little boy named Jacob when he was 7 years old. I think that was about 5 years ago now. He decided that he wanted to make sure he could spruce up the holidays for the children in his school that didn't have a Christmas tree per se. And so he and his mom, Andrea, kind of pulled together some resources, and they've grown significantly over the years, but they basically provide hundreds of little holiday trees, Christmas trees, to children in schools all over the area in Detroit. They provide them to nursing home residents, to shelter residents, and basically anywhere that they can help to provide, a little bit more, holiday or Christmas cheer. They have no overhead operating cost whatsoever. They work solely on donations and things that they can pull together with just being very resourceful. We teamed up with them a couple years ago, and this was our second year. They provided us with 400 of these tree kits that they put together that we could then share with our school partners, our Head Start partners, and the children in our program, our after school program on campus at Marygrove in the city. And so they do really great work. Yeah.
Please continue.
Oh, I was going to say, you can find out more information about Trees Giving from their website, which is treesgiving.org. And we love partnering with them. They're just an awesome community partner. Jacob is still very involved in running the organization, as is his mom, Andrea.
And you do such great work too at the Detroit Institute for Children, which people can find more information and get in contact with them at detroitchildren.org or by calling 248-926-0909 and find more information and ways to get involved. All right, if people would like to get involved, would like to help your organization, what are the best ways that they can go about doing that? And what sort of maybe volunteer opportunities are available with your organization?
Oh, so we have a few different ways in which people can get involved. We love time, we love talent, and we love treasure, right? So, people can volunteer with us in some of our programs, particularly our programs on campus at Marygrove after school during the summer. We're always taking donations through our website and through our Amazon wish list, which there's a lot of really great stuff on our Amazon wish list, which will help to support our Parents as Teachers program, our after school program, and some of our other therapeutic programs. And we're always hiring. We always have a need for excellent therapists, excellent educators, excellent social workers, excellent psychologists. And we have a lot of flexibility and we work in a lot of different ways. So we're looking for all types of help, whether you're somebody that would like to work for us, whether you're somebody that would like to donate time, talent, treasure. there's a few different ways in which you can get involved. If you'd like to volunteer, there's some information on our website, or you can call us. Same with donations, you can donate right through the website or reach out to us. And then there's links to our Amazon wish list through our website as well.
All right, just about 30 seconds left. Before we let you go, anything else that we should know at this time, or you'd like the audience to know we haven't discussed about your organization?
We are continuing to grow. Our footprint has expanded significantly, and we're always looking for new children and new partners to be involved in our programs. We opened space up on campus at the Marygrove Conservancy, which has a P20 model, which is basically care for prenatal through college, career, workforce. There's services for that. And so we have our after school program, and we have a great community space on campus at Marygrove. And so if anybody is near there, please stop by in the Fitzgerald neighborhoods where we serve all around that area. And we look forward to hearing from you and, maybe making some new partnerships and, let's get some new volunteers and some awesome stuff going on, as we continue into this new calendar year.
All right, we appreciate you joining us and telling us about these great programs, these great partnerships too, that the Detroit Institute for Children is involved with. Thank you so much.
Thank you very much.
More information can be found detroitchildren.org, or go to sharedetroit.org, find more information, get in contact with them, volunteer opportunities, and explore some of those wish list items that they may be in need of that you can help them with directly through their Amazon and other wish lists at sharedetroit.org. That is going to do it for today's edition of the Megacast. Thank you for joining us and all of our guests for being on today's program, as well as to our dedicated crew at the studio of My Michigan TV at Master Control, Jared Clark and Calvin Brown. That's today's program. We'll be back soon with a new episode.